It's a wonderful privilege for us to gather here to enlighten ourselves because we have a responsibility, as Subharas has told, to convey the message to society at large. And being a surgical oncologist, I would like to just mention a few things about the recent advances that we have in cancer therapy. As we understand, rightly said by Dr. Guru and Reddy, it is not just about treatment, it's more about the overall view of the disease burden itself, how to prevent it, how to have a panoramic view or the vision about the disease itself. And in terms of screening, in terms of preventing the disease, we have a long way to go. But the good news that as we have today is that cancer is not a death sentence anymore. I'm just reiterating what our professor has said, that treatment is very much available and cure is still a reality and hope is realistic. Especially, I mean, for solid tumors like breast cancer, cervical cancer, or GI cancers, we talk more in terms of minimally invasive surgeries these days. Gone are those days where you need to have a big incision, remove the whole breast. From that on, we have moved on towards a minimally invasive surgery like laparoscopic surgery. So that was introduced about in the year 1990. Laparoscopy has come. With that, a few keyholes you put in the abdomen and you try to remove the whole tumor. Well, from there on, we have moved to something called as robotic surgery, wherein you have a much better precise vision, enhanced vision to the tune of 10 times magnification you have. You feel as if you are in the abdomen and operating. So, precise anatomical knowledge, dexterity, all this has come with thanks to the advent of newer technologies like robotics. So, newer and newer technologies are helping us to give better outcomes to the patient. Today, we are not only talking in terms of curing the disease, but you also talk in terms of giving a better quality of life to the patient. It's not the question of how long they live, but the question is how well they live. So in terms of giving a better quality of life, yes, newer diagnostics, newer therapeutic measures like robotics are helping our patients in a big way. So in that regard, I would like you to convey the message to the people at large, primarily in terms of awareness for cancer symptoms. If you look at the burden of the disease in this country, more than 10 lakh new cases are diagnosed every year, out of which I would say about 60% are in females. So there is more burden in females. The reason is in our society, as the previous speakers have mentioned, women are the neglected lot. So they do not care for themselves. For them, the priority is family, children. So they do not even report a symptom that they have. So if only we can create an awareness for a common cancers like breast cancer, cervical cancer, endometrial cancer, we will go a long way in reducing this incidence, and overall the country's the economy also would improve by reducing incidence of cancer. So in that way, I would wish all the best for this coming up conference, the Global Cancer Conference and Medicare Summit. I wish all the best and success to the organizers. And to this conference, what I would expect is that we would come out with some guidelines. We always follow the Western guidelines. For each cancer, every time we see the text, we do not have our own data, we do not have our own guidelines. So a forum like this would make each of us to sit together and try to formulate guidelines so that we can treat our patients based upon our own data and based upon our own guidelines rather than blindly following the Western guidelines. Once again, I wish all the best for the upcoming conference. Thank you.